My name is Gaby Volbracht. I am a full spectrum doula with Tewa Women United, and today I want to show you how to do the hip squeeze. I recommend practicing this hip squeeze during your pregnancy with the people who will be supporting you in labor, so you can find that perfect spot and discuss your desires and your needs. First of all, I'd like to say that the most important part of this is to really listen to your own needs and your own body, and to surround yourself with people that are also going to listen to you and really respect your choices. You do not have to relinquish any privacy or move in a way or be touched in a way that's uncomfortable to you. This is your pregnancy, your birth, your labor, your baby, right? Okay, so here we have the pelvis. And a pregnant person's pelvis, towards the end of pregnancy, this hormone relaxin comes pouring into the body to loosen the ligaments and the joints, which allows the body to open and create more space for your baby to move down and eventually out. This bone here in the back of the sacrum does not move, however. It's a rigid bone. And so sometimes in labor, you can really feel the baby pressing against the low back, and this can feel uncomfortable or maybe just a lot of sensation. And so the hip squeeze is a good way to relieve some of this pressure and also create more space for the baby to move through. So beginning, behind the person that you're offering the hip squeezes to, set yourself up in a sustainable way. So we're not doing the hip squeeze off to the side or in a way that's like not going to work in our own body, because we could be doing this for a long time. We offer them during contractions, always checking in first, is it okay if I touch you? And then bringing the heels of the hands to the curved part of this hip bone here, the ilium. We're locating this on the person's body. And I really recommend doing this in pregnancy, so you have an idea of where it is and the amount of pressure and things that feel good for the person that you're supporting before you get to labor. So locating this part of the hip bone, and it's this really fleshy part on the side of the hip, bringing the heels of the hands here, and then we're going to press in and up. See how the fingertips are facing up towards what will be the shoulders, right? And so we're pressing in and up. And you can use the weight of your own body for this motion. So instead of it just being this great squeezing in, this great pressing of all of the pec muscles, right? As you're behind the person offering this hip squeeze, you can lean in using some of your own body weight to create the pressure that we need to make this feel really good. So I hope you can see here as we press into the sides of the hips, how the base of the spine, this base of this pelvic bowl, right, begins to open. So we're relieving pressure in the sacrum, opening space for the baby to move down. Yeah. And remember to breathe. And as you offer these hip squeezes, right, first we ask, may I touch you? And once we have consent, offer the hip squeezes, and then check in. How's the pressure? A little more, a little less. And the person who's receiving this hip squeeze will surely let you know what's working for them. Okay. So the hip squeeze can be offered in a variety of positions. You could offer them to somebody who is sitting in a chair, maybe sitting backwards on a chair, leaning onto the back support of the chair with the legs wide. And then you can offer the hip squeeze here from behind. So the hip squeeze can be offered in a standing upright position. Being upright allows extra oxygen and blood flow to your baby, can help to open the pelvis, and also allows the baby's head to sit right on the cervix, allowing applying direct and even pressure for the cervix to dilate. I recommend finding something to lean on. This could be a couch, a bed, a chair, a table, a counter, wherever you are. Give yourself a wide base so that you're solid and supported. And then the hip squeezes can be offered here, right? Checking in, is it okay if I touch you? How's the pressure? And then squeezing and breathing through the contractions together. Same thing here. Find a yoga ball to sit on. This allows some range of movement, some motion in the hips. So you can move the body around while also being supported. Again, allowing the pelvis to open and being kind of upright here for the baby to sit on the cervix. And finding something to lean on, a bed, a couch, a chair. And then hip squeezes can be offered here. I recommend practicing these during your pregnancy to find that perfect spot, and so that they're more comfortable in the system and easier to remember when the time comes. I also recommend writing these into your birth plan and talking to your whole birth team about your desires and needs for physical support. Thank you so much for taking the time to learn about the hip squeeze with me, and please check out the other videos from the Iya Vikagindi Doula Project.